most especially in my beloved country, Nigeria. I really do hope that this conference will be of value, and I do also pray that we will be able to make this an annual program to make sure that Nigerian midwives are connected to the best in midwifery skills around the world. They can also pass their own unique knowledge to midwives around the world. I'd like to thank you all, and I would like to pray that God bless all our efforts and help us reach scale. Thank you very much, and I wish you safe journeys home. Amen.
That was the ICM Global Goodwill Ambassador, Her Excellency Mrs. Toyin Saraki. In spite of the challenges, she still sent in this message that midwife or associated with a midwife also 24/7 have commitment to work. Thank you very much. Well, one of the major partners for this assembly that we have today is the UNFPA. The UNFPA, I'm informed, is giving quality life to women, to children, to adolescents, and beyond that, particularly in the northeast of Nigeria in recent times. The UNFPA has been involved in ensuring that our women are safe, given where they can deliver children and have some measure of succor in spite of their situation. UNFPA has been involved in ensuring that we can plan our families and have children when we can look after them. UNFPA has been involved not just with women and children in difficult situations, but also with the youth, giving them the true picture of what growing up is all about. Beyond that, also moving the promotion of family planning commodities, which I'm sure our midwives here will be very excited about, because when the woman has rested before her next child, you can at least be sure that a lot of complications will not arise from that. So we need to give it up to UNFPA country office in Nigeria. Can you please do that with me as I invite the UNFPA resident representative in Nigeria. She wants to become a Nigerian herself. Madam Ratiza Indalovo, to give us a good message. And it's titled Strengthening Midwifery in the SDG Era, from Evidence to Implementation. Just one thing before you take the presentation. Joining us and already seated is Her Excellency Hajia Hadiza MP Abubakar, wife of the Executive Governor of Bauchi State. She had an initiative for Bauchi State.
Thank you very much, Your Excellencies on the high table, distinguished participants, ladies and gentlemen. I'm going to give a very brief presentation, and as we heard already from our MC, it's titled Strengthening Midwifery in the SDG Era, from Evidence to Implementation. Now, the outline, I'll start with Sustainable Development Goals and the centrality of midwives in the SDG era. Evidence for action, that is why invest in midwifery. And then I move on to action and implementation. Now, this slide is just to remind us of the 17 goals. I'm not going through it, we all know them. It's just a reminder of our 17 Sustainable Development Goals. We move on now. During the delivering SDGs. Elements that help to frame and reinforce the universal, integrated, and transformative nature of a sustainable development agenda. And it is around these 6 elements that all the 17 goals are centered on. Now, what is most critical? Me, I've always said the SDGs came for midwives. And if we do not do something about midwifery services, we will not achieve the SDGs. Now, if you look at the list on the screen, you'll see that one of the elements, of the 6 elements, and the first one for me is people. And this element is talking about life, is talking about health, is talking about, the centrality of gender, women's rights, empowerment, and so on. Now, if it's talking about people and talking about health and life, who will bring life into this earth besides the midwife? It's the midwife. All of us here, we owe our existence in this planet to some midwife or somebody who was trained in midwifery services. So we owe the existence of humanity to midwives, because it is the midwives who usher us into this world as we are created after God's creation. So people is central. Maternal, neonatal, and child health is all under people. And that whole area of maternal, neonatal, and child health, it is the midwife that will make it happen. Now, of course, that is the direct contribution of the midwife to make us have people in this world. But they will not be able to do it effectively if the rest of the 5 elements of the SDGs are not addressed, even directly around them. Dignity. The SDGs are calling for gender equality, respect for women's rights. And we all know the majority of our midwives are what? Are women. Am I right? Yes. They're women. But as women, as midwives, they face a lot of gender-related barriers and obstacles. And because sometimes it is our men who are moving the machine up there, making decisions, we don't have decisions that protect the rights of the midwife. Where are we with their professional career path? How far are we making midwifery a very lucrative profession that everybody wants to go into because they can see their future going up? So these are some of the things that dignity is talking about. Justice, the establishment of strong institutions. That was those SDGs are talking about. Strong institutions. Now, we will not be able to have life and healthy life delivered by the midwife if we don't take care of the midwifery institutions. Time is gone when governments give a blind eye to the midwifery schools, where we have dilapidated schools that do not pass the test of the global international standards, and so they lose their accreditation. We need strong institutions. And sometimes when I look at this particular element, it doesn't take much to buy the equipment that is required by the midwives. And yet by doing it and getting them quality training, you will have saved so many lives. So justice has to be done for midwives if we are to achieve all the other SDGs. The planet, that's the environment. SDGs are placing a lot of emphasis on the environment. And we all know the challenges that the midwives go through if governments will take note. A midwife is sent out into the rural areas to provide service at a PHC where there's no water, where there's no light, where there is no accommodation. environment for her to operate. I've gone to some clinics somewhere else where the midwife during labor is to rush to get a bucket of water somewhere and try to wash. It doesn't work. We need reticulated water systems in every PHC. We need light in every PHC. Now, you see, the SDGs emphasize sustainable economic growth, inclusive growth. That's what we don't want to just count the GDP. We want to see prosperity among the masses of this country, of any country, after all. But to tell you, before we come to a point where women are empowered, we'll not get there. I'm very happy. My brother talked earlier, the role of midwives in empowering women through education, information, and they have a multifaceted array of responsibilities that they can do. They deliver family planning, HIV prevention, PMTC. It's the midwife. And it's through educating the women, especially in the sexual and reproductive health and family planning. That's the strongest way of empowering a woman. I'm actually here because I took care of family planning for me to go back to school and study my degree after I dropped off because of poverty. I never believed that poverty should stop you from pushing through and do something. Because I went through it. So what I'm saying here is, this prosperity they are talking about in the SDGs is an important element. We will not reach there until we empower women. And the midwives have a critical role to play to empower women, to have family planning, to take care of reproductive health, and send their children to school because they are healthy, they are happy, and they have quality of life. And then the last one they give us from the SDG process is partnerships. Oh yes. Now, a well-trained midwifery workforce, which is well-equipped, which is motivated, and empowered, can only happen if there is partnership. No one organization can do it alone. No one organization can address this. What we need is the government as number one to come on board together with the NGOs, private sector, the UN, to rally our resources around the midwife. But this is not what is happening at the moment. It's unfortunate. Very little resource goes to midwifery programs. And it's like trying to squeeze blood from a stone, trying to get money for midwifery programs. But why is it like that? It means that we are all crying for MNCH, maternal health, maternal neonatal health, and we are hitting the wrong buttons all the time. Leaving the correct button, the green button, that will make us getting it wrong. And I've said it over and over again. They are getting it wrong. Hit the midwife, support the midwifery workforce, midwifery service, from training, from everything, and you'll get it. You'll get there. So I want to really appeal to all partners to come together. Let's move on. Okay. Now this slide is just showing that SDG 3 and 5 is where they directly deliver life. Directly save lives, provide healthy lives. And as you can see, it's to ensure healthy lives and promote the well-being for all at all ages, achieve gender equality and empower all women and girls. And of course, when you go to the indicators of the SDGs, you of course see all these things like the family planning, all these things, you see them. But I've just highlighted only 2 targets here: to ensure universal access to sexual and reproductive health care services, including family planning, information and education, and the integration of reproductive health. And then target 5.6, ensure universal access to sexual and reproductive health and reproductive rights. So this is what the midwife will be able to help us achieve. Once we achieve that, everything else will come into place. Because people will be enlightened, they will have everything will come into place. Now, what is the evidence something. Why should it no longer be business as usual in the SDG era around the midwives? In Nigeria, for example, we have insufficient midwives, especially in rural and hard-to-reach areas. We all know that. And I'll come back to that later on. There's a critical shortage of midwifery tutors. You know, sometimes because I have a passion for midwifery, when I go, I'm looking for who are the midwives here. Who are they? I'm asking, you know, in the hospitals. And I went to one particular hospital in one state, and they all came, they said, oh, where are the midwives? Where are the tutors? Oh, I'm retiring in December. I'm retiring next year in January. I'm retiring. And they were all ready to retire. Most of our midwifery tutors are on the verge of retirement. And what is going to happen when this crop that was, got long back, now fully retired? Who is going to train? Even if you build these schools, who is going to train? And don't forget, the number of students that you can train you can enroll in the midwifery school depends on the number of tutors there. So this is very So the support of midwifery tutors is critical if we are going to continue to train more midwives. Then there is also now several of our midwifery schools have lost their accreditation. I've said this already before. And because of all this, because we're not giving attention to midwifery, what is happening is that we have embarrassing and shameful indicators for maternal and neonatal health. 10% CPR for a country like Nigeria. All the resources, all the intelligence, all what you need, but only have 10% because we are eating the wrong pattern. SBA only 38%. Birth in the home 60%. Maternal mortality is so high, and if you translate it to simple words, every day in Nigeria over 111 women die in childbirth. If you calculate that per day, over 111 women die every day. And this is an average of the country. If you go to some states, their average at state level is over 200 people every day dying. And we are just looking, and we are not looking to say, what are we doing wrong which makes us not achieve the result? Reflect and see, and the reflection will get you to the midwife. Let's move on to the next one. I'll try to go faster now. I get too fast with the midwife. I have to go faster now. LNCH workforce availability in Nigeria. Now, it might look small, but I will explain it to you. Now, the first good thing is that for maternal and neonatal health, the health cadre that provides, one of the health cadres that provides 100% of their time to MAH are the midwives. 100% of their time spent at work is about maternal, neonatal, and childbirth. So if this is the case, what is going on? Now, if you look again at Nigeria, we have a large percentage of people trained to be midwives. Large numbers, which is not bad. But they are not practicing. I like your answer, your answer. It is about practicing. So many are trained, and then they don't practice. So what does it help us? So we need to look at what makes it go like that. So, and then you find the majority of those that are practicing, that 40% are in Lagos alone. And then the rest are distributed mainly in the cities, state cities, capital cities of the states. And in the rural area where the need is greatest, there are no midwives. Very few midwives. So we need to look at this. The distribution of the workforce is to be taken into account. Now, key actions for implementation. What should we do? The next slide. The key actions, they border on 4 key actions. Making sure the midwives are available. Somebody's not rolling the screen. Making sure the midwives are available. Educate more midwives. Use international standards. Ensure that the midwives focus on midwifery practice and make sure they do that. Access accessibility of the midwife. Are they accessible to those who need the service? Bring the midwife or midwifery services close to the women. Let them be close to where the need is and not far away. Then acceptability of the midwife. We need quality training of the midwife so that if they have quality training, they learn how to behave and to be acceptable by those that they see. I know that there are some stories told of midwives who will claim you if you don't push, you're not pushing. Come on, push, That's not what we are looking for, isn't it? Yes. So we want quality education that helps the midwives to be respected and wanted because of the way they behave and treat their clients. Then we need quality. Now quality is very important. We need to, the quality is in many ways. Close the gaps in infrastructure. There is not good infrastructure, resources and so on. And then the regulatory bodies of midwifery are very important. They help to regulate, register, relicense midwives, so that we go to you. And then the next one, last one on action is investing in the primary health care. My sister from the Ministry of Health just gave us a snapshot of the primary health care under one roof, one PSC in each ward and so on. And that's our opportunity in Nigeria. That's the opportunity we must grab as midwives, as partners, to say, okay, this is the way we are going to strengthen the midwifery services. It is the midwives who will head these PHCs. I hope I'm right. This is what I got from the minister in one meeting. So the midwives, and we need a minimum of 2 in every PHC. We are not there, but we have to do something to get there. So I can say Nigeria is ready for the SDG. But what we need to do is to do it and make it happen. Make sure we have sufficient midwives to go around all these countries and make it deliver. So midwives are central to the implementation of the one functional PHC they want. And then finally, they are addressing the cardinal principles of HRH. Of course, it's the production, I've already talked about this. It's also the deployment, they need to be deployed, and retention. I want to say a little about retention. You know, we need strategies that will make midwives be able to work in rural hard-to-reach areas. We have to be sensitive to their needs as well. Because if we just say, oh, go, and you don't give some kind of package to motivate them to go to that area and be able to find a way, it will happen. The husband will say, no, you can't go. When there's no house, where are you going to stay? You will not go there. There's no light, there's no what. So we need to make sure we make the conditions conducive to them who want to go there. And then they'll all run away from the cities to want to go to the rural areas. Provide a conducive working environment and keep our midwives motivated. Thank you for listening.
That applause is not loud enough. We could do better with a standing ovation for Madam Roxelle Glory. A standing ovation if you mean business. Thank you so much. Thank you. Please be seated. Whoa. I want to refer to you from now on as the voice of the voiceless. And I'm sure the midwives themselves, with the constant ovations and claps and applause that came intermittently because of your presentation, are really elated. If you are, please one more round of applause for that. Thank you so very much. It is indeed an opportunity for us to hear these. And I'm happy that the Honorable Minister of Health is being represented at this occasion, because it is one thing to talk, is another thing for those talks to be implemented. Am I right? And because we believe that this is an action minister, he will implement all that Madam Radzai Lowe has propounded. Can we please give them, the Honorable Minister, a round of applause in anticipation? Thank you so much. Your Excellency, the wife of the President of the Federal Republic of Nigeria, ably represented at this occasion by the wife of the Speaker of the House of Representatives, Your Excellency, Mrs. Gimbia Berna, Your Excellency, the wife of the Governor of Bauchi State, and just joining us is the representative of the Lagos State Governor's wife. I'd like us to please welcome her with a resounding applause. Dr. Mrs. Ibironke Shodende, Permanent Secretary of Lagos State Primary Health Care. Please, another resounding applause for her. Thank you so much for coming. In moving on, according to the words of the erstwhile President of the United States of America, Abraham Lincoln of blessed memory, he says, and I quote, "I might be a slow walker, but the good aspect is that I never walk back." Unquote. One step at a time, and the midwives are today marking the National Day of Midwife. I'd like us to applaud yourselves. Thank you so much. And very soon, we will have midwives take their rightful place in our society, in our health centers, in our clinics, in primary healthcare centers. So it is on this note let me welcome the Director of Nursing from the Federal Ministry of Health, Mrs. Mojiko Tuba. Please, a big round of applause for her, please. We will still have a seat on the head table. Okay, may I please warmly invite you over to the head table. Please bear with us. Thank you so much. She was with us throughout yesterday, and she's found time again to come today. Yes, may welcome the event. Thank you. Your Excellency, the wife of the President, I'm excited that out of your very busy schedule, you found time to come felicitate with the Nigerian midwives. And in felicitating with them, there are some issues that are so very germane that have been actually mentioned in the course of a few presentations that you've had cause to listen to. But I know the best times to get the man to listen to you is when both of you are in bed. So I believe that Mr. President will get to hear all that has been said about the midwives in Nigeria taking their rightful place in our society. If you believe that you convey this message to President Buhari, I'd like us to applaud her in very loud manner. Thank you so much. Let me therefore at this juncture invite for her keynote speech. In talking about keynote speech, I like to say this very quickly. A friend of mine, Emil, was invited to an event, far older than I am. And then at the event, he was meant to give a keynote address. And the next thing, the man came, took the microphone, mounted the podium, and says, observed all the protocols, and says, I do not want to waste your time. I have been told that what I have to do here is just to give a keynote address. And the keynote address will be very simple. I have decided that the address is on the note. The key is here. Anybody that needs it after the program, follow me and collect it. Thank you, ladies and gentlemen. That was my light and word. May I therefore invite for her keynote address, President of the
Her Excellency, Mrs. Abuja, representative of the Honorable Minister of Health, Mrs. Watson Jackson, country representative, Ratty. How am I going to follow that speech? That was excellent. Distinguished members of the National Nursing and Midwives Association, other Your Excellencies who joined the table, distinguished representatives of all the collaborating partners, distinguished ladies and gentlemen, midwives. Before I start, I wanted to share something personal and then to clarify something. We've been talking about, and Moji's been talking about midwives and being in the delivery room and being in the delivery table. Well, I've had 3 babies. I've never been in a delivery room, and I've never been on a delivery table. Midwives practice everywhere and anywhere. And I think when we look at this figure from Zerati of the 60% home births in Nigeria, I think that 60% unattended birth. And we need to make that distinction. Because in many countries of the world, women can and do give birth very safely at home. But first, to begin, my thanks to the Nigerian nurses and midwives, and especially to Her Excellency Toyin Siraki, the ICM Global Goodwill Ambassador, who first shared her thoughts about this conference last July when we were on a flight back from the Americas Region Conference in Suriname. What is special about today? I think we've heard a lot. Today, we celebrate midwives and their part in providing care to women and the newborn. Today, we also remember the tens of thousands of women who have no access to a competent, qualified midwife. I am pleased to bring the greetings from the ICM board and staff and of the 400,000 midwives across the world with whom we share this day. I am absolutely delighted to be here in Nigeria, although I'm disappointed that Her Excellency isn't here with me. But she has been with you. Today, we are, Today, I want to begin with 3 messages from, this is having an epileptic fit, I'm afraid. Could you go to slide 2, please? I want to start with the key messages for IVF. And they are not new messages, but they are important. And they are important enough to repeat and repeat and repeat. Every woman should have access to a midwife. And when the ICM says midwife, they mean a midwife who is educated, who is competent, who is skilled, who has the correct attitudes to practice. Now, midwives provide care with skill and compassion. Sometimes that's missing and we need to work on that, but that is our aim. The best partnership for a pregnant woman is with a qualified midwife. So us globally, Nigeria comes first, 90%. You know, when you look at the state of the world's midwifery, and the figures are absolutely mind-boggling because this is such a populous country. But in 2012, Nigeria had an estimated total population of 168 million. 109 million, 65% were living in the rural areas. And 38 million, 23% were women of reproductive age. Total fertility rate of 6, and we heard the CPR percentage just now. And this population is projected to increase by 62% to 273 million by 2030. You have to start today. You have to begin today. That brings many challenges. This was shown on a slide, and this is from the Save the Children report, and there again, Nigeria features as one of the worst countries for a baby to be born, poorest maternal mortality rates. You can see many are in Africa, but Nigeria comes out on top. So the challenge is to achieve universal access to sexual, reproductive, maternal, and newborn care, midwifery services in Nigeria must respond to 12.8 million pregnancies per year by 2030, 59% in rural settings. There are many health systems implications, and including how best to configure and equitably deploy this workforce. I don't envy you, but there is good work being done, and there's lots of evidence and tools to support you. Why are we focused on the midwife? I like showing this slide. It's a slide from Sweden, and it shows the midwife, what I'm calling the midwife effect. What countries see when they introduce and equip midwives and place them near to women. If you look at the death rate on the axis, going the vertical axis, which goes 100 up to 400, and you look at the horizontal axis going across, a picture of several documents. These are global documents, some are global evidence, some are global strategies. The State of the World's Midwifery, the Lancet series on midwifery, the most comprehensive piece of research on midwifery ever done. The Every Newborn Action Plan, Ending Preventable Maternal Mortality. The Human Resources Strategy, WHO, which is going to be discussed at the World Health Assembly this year. The Lancet Commission on Women and Health. The Every Woman, Every Child, the second global strategy, and the Sustainable Development Goals, which I won't talk about because Ratty has. But let me just talk about the Lancet series on midwifery. This series identified midwives as the essential link in the continuum of care. It repeats what Somi said because it has the evidence that educated, trained, licensed and regulated midwives can provide the full scope of midwifery as is defined in the series. And when they talk about providing 87% of the essential interventions, that refers to a magnificent document that the Partnership for Maternal and Newborn Health and the WHO at the Aga Khan University published in 2012. I wonder how many of you have seen that document. Please be honest and put your hands up. Right. There's a lot of work to be done. In that document, it identifies the 56 interventions that save women's and newborns' lives, 87% of which can be done by midwives. But if you don't know that that exists, how can you use it to advocate with your government? You have to do your homework. It's all available on the website. I want to just talk about the global strategy, which focuses on survive, thrive, and transform. Under the survive element, it's the end preventable deaths, both maternal and newborn. And it sets some targets. A maternal mortality ratio of 70 per 100,000 live births by 2030. A newborn mortality rate of 12 per 1,000 live births. And an under 5 mortality rate of 25 per 1,000 live births. So when you hear people talking about 70, 12, 25, that's what they're referring to. The Commission on Women and Health is a gift to us. It's a gift to midwives. It makes 4 key recommendations, and they're primarily about midwives, but it also it's primarily about women, I beg your pardon, but it also refers to midwives. It talks about valuing women, what women bring to a country, the productivity that they bring, and I say, value midwives. It talks about compensating women for the work that they do, and much of the work that they do is not compensated because it's hidden and much of it's in home. But I say we also have to compensate midwives. Midwives have to be paid appropriately. It talks about counting women, and I think this is particularly relevant for when you look at maternal death. That we ensure that women who die then are not lost to the system, that they're counted, that they're registered, and that we learn lessons from it, that we don't repeat the mistakes. And we need to count midwives. And you know, when they were producing the State of the World's Midwifery report, that was a tremendous problem. Couldn't count midwives. Because every country has a different definition. And some countries will have 4 types of midwives, and some will have 3 types of midwives. ICM says there's 1 type of midwife, and that is the midwife that meets the definition of the midwife. That is the midwife. The 4th recommendation from the Commission on Women and Health is that governments and us, we need to be accountable to women. We do. And I think midwives need to be accountable to women, but we also need to be accountable to midwives. I want to show you a framework. And this came out of the Lancet series on midwifery. And it's a framework for maternal newborn care. This is a framework that every country can use to ensure that they put services in place. I won't talk about it in detail, but everything that you need, good services for your people, is within that framework. And can you see the dark blue line around it? Can you see the dark blue line? That is the role of the midwife. All of that. We know from the research that midwives have a pivotal role in reducing maternal and newborn mortality and morbidity. Yet, in some countries, the increased access to what is called skilled attendance at birth, and this is primarily in low and middle income countries, has not always resulted in the expected reductions in mortality. And this points to the lack of quality. Quality is absolutely vital. Hot off the press and available on the ICM website homepage. Research that was done by WHO, USA, ICM, WRA, and others. And this evidence indicates that strengthening midwifery is a key to improving quality of care and achieving international standards. Yet implementation of educated, trained, regulated, licensed midwives remains inconsistent, and it results in critical obstacle to process. But if you look at those 3 elements, this is what midwives are saying prevents them providing quality midwifery care. Social aspects, economic aspects, and professional aspects. There are the things that we need to address to ensure that we provide quality care. Now, Her Excellency in her video message talked about the midwifery services framework, so I won't go into any detail. But this is what it looks like. It's a step-by-step approach to ensuring that services are provided in a really good way. But ICM doesn't come into countries and say this is what you should do. Governments have to invite the ICM in because it has to be owned and implemented in country. So for those of you on the high table, if you would like ICM to come in and introduce you to the framework so you can decide whether or not you want to run with it, then the ICM Chief Executive needs to know that. I want you to just balance, a little seesaw. Because I hope that one of my messages today, and messages that you've been hearing over the last day and a half, are that small changes can have an absolutely huge impact. When you look at the issues facing Nigeria, and I watch the news and I read the newspapers when I'm in the country, they're enormous. But there is a small change that can be made that will make an enormous impact. And that is to educate, regulate, deploy, and equip midwives. So there is 1 or 2 in every village. That small change you can make. The productivity, the outcomes of that will be enormous. You know, according to the World Bank, creating employment opportunities in underserved communities to make sure that universal health coverage is achieved is dependent on a high-performing workforce, quality education, and adequate remuneration of staff. Investing in midwives aids economic growth, employment, and empowerment of women. I want to conclude with a few other messages. I have some messages to the policymakers, to the decision makers, the parliamentarians, the politicians. It's a message you've heard before this morning, and I'm sure you'll hear it after. Invest. Invest in quality education and regulation of midwives. Employ and deploy midwives to make them available. Recruit from the hard-to-reach areas. Make sure that they're available, accessible, acceptable, and then you will have quality midwifery services. Your constituencies and your constituents deserve and demand this of you. I am sure that all of us in this room would want a competent, compassionate midwife to care for their mother, their sister, their daughter, their niece. I want to use the words of Toyin in an article in the Daily Mail this week. And she said that Nigeria must invest in an army of midwives to cut stillbirth and maternal death, and it will do much more. And a message to midwives. Solidarity is really important. Midwives are sometimes not good at sticking together. And we need to, learn that lesson too. But we also need to be very clear about our identity. Because when you know who you are, when you can talk from a position of knowledge and strength and status, you're more likely to feel able to be up there, leading, negotiating, and being in one with your colleagues. Solidarity is important. Be proud, and I've seen it today and I've heard it with your singing, to say, I am a midwife, and I work with women, and I give respectful care. Toyin also said, and I quote, I want Nigerian midwives to be able to stand on an equal footing with midwives from around the world. I'm sure you do too. I want you to do this exercise as I come to an end, and I'm going to put this down now and hope you can you hear me from this? So, today is a day for all midwives to stand tall, and if you look at the ICM website, it's inviting. I'm a midwife, and this is what I do. So I'm going to start. Advocate wherever I go. Now I want all the midwives in this room to stand and just say, I am a midwife. But those of you who are not yet standing, I would like you to say, I'm not a midwife, but I'm proud of midwives and I support them. So all of you are not midwives, please stand. I think together we can make the change, but we all have to do it jointly. So thank you all very much. All the corporate lives in this room.
Thank you very much. I am a proud associate midwife. Well, the challenges have been thrown to everyone in this room and beyond. And like I said, it's a 24/7 call to duty. We do hope that all the points that have been raised there by the ICM president will be the take home. And that next year when we meet and where we meet, Nigerian midwives and their interventions will stand tall, and tall is still saving lives, mothers and children. We move on now to the next speaker, and for your own records only.
Sorry. Where's the Oga?
Well, my colleagues, you will need to stretch yourselves so that the participants can get a view of who is speaking. Please, particularly the still cameramen, when you've taken your shots, please can you just find a place to stay so that people can see. We'll do that before the next speaker takes the podium. Thank you.
Thank you, me.
Thank you very much. You can take position by the aisle where you can still situate your cameras and still get a good view. Thank you very much. A round of applause for the media for their support. Thank you. I beg you, please. Can we do that because we need every publicity? By my left flank here, I think cameramen can take position. If we all are here, we're going to be blocking views, please. Thank you. We need for them to capture the speakers. We must find a way to work together. That's the spirit. Thank you. We're moving on now to the next speaker, and I'm going to be very strict with time. But you know, I think midwives are the luckiest hands and fingers. You know, they bring forth kings, they bring forth queens, princes, princesses, name it. Even the speaker, I'm sure, was delivered by a midwife, the speaker's wife also. For your information only, and not for the media, the next midwife actually delivered the new prince and princesses of England. I'd like to introduce to the microphone Dr. Jacqueline Duncan-Bent, Professor of Midwifery, NHS, England, who will be speaking midwife as a catalyst for midwifery.
Thank you. Thank you so much for inviting me to speak at this conference today. Thank you to the distinguished guests. Thank you to the representatives from government, and also a big thank you to Her Excellency Toyin Siraki. So I, along with colleagues, and I have to mention Felicity Okoko in particular, midwifery supporter for the Wellbeing Foundation, and others have, we've come along from the UK today, or rather not today, a few days ago, and can I just say that I was here this time last year, but I was down in Delta State. My work, NHS England, have released me to come to Nigeria for the second year. And I'm really running out of second chances here, but I had to come to support International Day of the Midwife. So can I just say that the first slide, if those of you look to your right, some of you look to your left, we have an amazing profession. I am, for those tweeters, #proud to be a midwife. We are retweeting internationally, late last night, early this morning, the great things that are happening in Nigeria. Thank you for the social media lead in the Wellbeing Foundation, who's doing a sterling job. My colleagues back in the UK are retweeting. The message is out there. You are doing a great job, and you are to be applauded. #proud to be a midwife. Just if you look at the little symbol to the left or the right of the screen, midwives light candles every single day, every second of every single day. For those midwives that work in adverse conditions, we've heard many speakers over yesterday and today, no light, I understand about NEPA, I know about NEPA. So no light, no water. We've got to battle with infection prevention and control. But what does Martin Luther King say? Just look at those words. It's something that I take with me on most days. If I can't run, if I can't crawl, if I can't, of course I can't fly, but actually I will get there. Midwives get there. We do the best that we can do for women and their families. I am #proud to be a midwife. Okay, so moving on. We are proud. We have much to celebrate. However, so next slide, please. So I asked 100 people, Nigerian people, not necessarily midwives, this question: why should your right to life be influenced by geography? Why should that be? Why do we have unwarranted variation across the globe? Why should that be? Would that be tolerated in any other profession? And they said, these are the themes that emerged from those 100 responses. It's a fact of life, Jackie. It's just the way it is, Jackie. Things will never change. The problem is too big. The people don't help themselves. It's the government's responsibility. Out of those 100 responses, they're the themes that were pulled through. The fact of the matter is, and we've heard the data, I don't need to repeat the data, the stillbirth rate is unacceptable. We should not tolerate, it should not be tolerated, regardless of where you birth across the globe. So what we need timely access. Women need to be able to access a midwife. Every woman deserves access to a midwife. They deserve to have continuity of carer. The evidence, research-based evidence, tells us that if you have continuity of carer, you will have good outcomes. We need to embrace that. We need to listen and empower. There is something about risk assessment and fecal surveillance that midwives can do well. Listen to women regarding reduced fecal movements that cost nothing. So effective fecal monitoring, antenatal and postnatal mental health screening. Why do we take care of the physical and forget the psychological? The prevalence of postnatal depression that starts antenatally is high. We cannot remove ourselves from that. The hidden challenges of domestic violence. We run some wild messages, but these messages need to be heard by all. The midwife's role is not just the physical, it's the psychological. There are issues that we need to embrace, and so on. I've got a thing about data. We have too much data, and we have little information. The data that we have is inconsistent, it's not measured in the same way. So, this next slide just refers to a vision for midwifery care. And there is something about being safer. We are safe as we can be now, but there's something about being safer for tomorrow. And I'm now thinking about the young graduates, maybe not so young, but they are new midwives coming through the system. A more personalised care, kinder care, professional and more family-friendly care. These concepts should not be new to any of us. They cost nothing, but they add years to life. If we invest at the beginning of the pathway, it's cheaper in the long run. That's very simple, but we can't seem to make that a reality for all across the globe, least of all Nigeria. And there's something about a culture, there's something about belonging to high-performing teams. We shouldn't pay lip service to education. There needs to be a commitment for continuing professional development. Not just a day here and there, but other professions have robust, rigorous competency frameworks that build a program of education that's fit for purpose year after year. This should not be a one-day event. Next slide. So what do we know? This is what we know, and you can see that for yourselves on the left and the right of the screen. What do we know? And so, with regards to that, whose responsibility is it? Whose responsibility is it to ensure that our workforce is fit for purpose, that we have the ratios right? Why is it that in certain parts of the globe we have a ratio that's supported, that enables women to have great care from midwives, enough midwives, and in other parts of the globe it's acceptable? It's actually acceptable not to have enough midwives. It seems to be acceptable that when you become pregnant, that euphoria of being pregnant, that happiness is marred by, will my wife, will my partner, will my auntie, will my mother survive this journey? It shouldn't be. Unwarranted variation needs to stop. But how do we achieve that? Next slide. So there's a whole system approach. I'm not going to go into the detail here, but it's the multidisciplinary, multi-agency approach. Behind each of these cells, there are many categories in terms of levels of support that are required. Community, individual, self-care, community. The organisations, the regulators, the schools, and also just thinking about the government and its commitment to women, the life song of continued life. Where would we be if we didn't invest at the start of the journey? So for maternity safety, there are key things that we need to have a commitment for. Now, to do that, the contributors to safe outcomes of care, we have continuity of care. I've mentioned this before and I'll mention it again. If you have continuous care, you can identify with consistency some of the concerns that women are expressing because they know you, they get used to you, they trust you. Women trust their midwives. Women listen to their midwives. You don't realise, maybe some of you do, how important you are. I remember a birth that I attended 25 years ago. That woman came back to birth in old age, and she remembered me. She remembered my hairstyle, she remembered my smell, she remembered what I said to empower her. You will be remembered. Think about compassion, think about respect. These are the words that she shared with me. The uniqueness of our contribution. The water birth that I was privileged to deliver in recent times. The baby was birthed underwater. I lifted, as the midwife, the baby to the surface. I put the baby on Mum's chest. Obviously Mum was in the water. Dad wasn't in the water, but they are in the water at times. And Dad looked at me, and it's that look, you know the look, that look from the mum and the father, the eyes well up with tears, and he looked at me and said, Jackie, it's a baby. I know that sounds really funny, but some people cannot understand and commute that in there grows a baby that they see. How is it? How does that microcosm of a cell turn into something that is going to give you sleepless nights? How is that going to be? So this slide really, continuity carer, multi-professional working across boundaries. That is a societal problem. It's a challenge for government. How do we move into rural areas and support those midwives that are working against the wind to provide a good service? Next slide. So, and this is my penultimate slide. And actually, shall we just go to the next slide first, and then we'll load up the video, Jessie? So, next slide. So, really, my overall message to you is, I'm not telling you it's going to be easy. It isn't easy, is it? You know, we're part of the joy of birth in 1 second, and then we deliver a stillbirth in the next second, and we're consistent, and we're proud, and we contribute well. That woman that we'd seen previously having a good, live, happy birth wouldn't necessarily be the woman that we would see if she birthed a dead baby. But that's the reality. That's how equipped we are to move from one set of emotions to another. So back to the previous slide. I'm going to show a little video clip to you, if I may. And I'm going to show this, and it's abstract, okay? So you will not see a baby birthing. You will not see a midwife. But there is something about moving this agenda along. We need to be consistent. Babies should not die. There should not be avoidable deaths. We should be behind our midwives to be the best that they can be. But we need support. My hand in your hand. That's why many of us have flown over from the UK today. You're doing a great job, but we want to hold hands. We want to spread this globally. Nigeria is on the map. Nigeria will make a difference to the poor outcomes, but we must join together. So, I'm going to talk you through this video at the end, but if you just watch this, and we want high volume, Jessie, and thank you. So that doesn't look familiar. That doesn't look familiar to me, Jessie. Oh, okay. No, that's not the one I gave you. Derek Redmond, please. So the first one you had on the screen, the Derek Redmond. So, I'm going to just wander over and just have a look at this screen, but the moral of the story is that you had it downloaded. So the moral of the story is that it's just going to get it up. There's a race that's going to be run, and I like midwives to running that race. But in that race, there's a problem that occurs. And for those of you that are old enough to remember this story about this top athlete, there's a problem that occurs, and help arrives. And that help helps that person along the track, but they know when to let go. Midwives need help, and others need to know when to let go. So hopefully we'll get the clip. Okay, so Derek Redmond. Do you want to play?
When troubles come and my heart burdens deep, then I am still and wait here in the silence till you come and sit while here. You raise me up.
you give it to me a standing ovation? And let's make it a standing ovation. That's a presentation of a professor of midwifery, Dr. Jacqueline Bennett. Please, another resounding applause. When she came and started presenting, there was a beautiful quote from Martin Luther King, and then there was one other one that says it's not easy. And the song directly came to mind. That song, it isn't easy, it isn't easy, but we'll surmount it somehow because you are dogged, resilient people. I need you to please put your hands together for yourselves one more time. Thank you. Your Excellency, moving on, would like to, at this juncture, listen to a presentation on women and newborns, the heart of midwifery, by Mrs. Margaret Akeshola, the President, National Association of Nigerian Nurses and Midwives. If your hands are not busy, please let's welcome her to the rostrum.
Thank you very much. You will permit me to stand on the existing protocol because of our time. Women and newborn, they have midwifery. Who is a woman? She's an adult female human being of reproductive age, a woman who has a specified job or position, a woman who is endowed with all physiological and psychological to carry pregnancies through labor and nurture newborns. A woman is the first eyes to see a newborn, recognize the baby, and be there throughout the developmental stages of childhood. Who is a newborn? A newborn, also referred to as neonate, is a child immediately succeeding his or her birth and continuing through the first 28 days of extrauterine life. These few days after birth determine significantly every other developmental stages of every child. And that is to say, it depends on the survival rates of that newborn to grow to maturity. Then we are talking about the woman and the neonate has a heart of midwifery. And midwifery is an art. Midwifery is a skill. And who are these ones endowed with these skills? They are the midwives. And who is a midwife? A midwife is a professional of midwifery. A professional in midwifery that has the skills to really perform the art of midwifery. They provide care to women during pregnancy, birth and postpartum periods, even beyond, because you see them taking care of the neonates, of the newborn, the neonates, and even the children, especially in the area of breastfeeding, to sustain the child to thrive and become what the child is meant to be in life. They also provide primary care related to reproductive health, including gynecological examinations, family planning, menopausal care, to mention but a few. Then we are talking about the woman and the neonate at the heart of a midwifery. Fine, midwifery is an art, but how do we bring these children to life? How do we sustain them in life? What are the health indices that we really need to make sure that the child survives? So the key facts about maternal and child health. We know that in Nigeria and throughout the globe, approximately 830 women die from preventable causes related to pregnancy and childbirth I say preventable because if the midwives are there to really do the work, all these issues that lead to death can be averted. 99% of all maternal deaths occur in developing countries. Why? Maternal mortality is higher in women living in rural areas and among poorer communities. Why should this be? Why should we have more of this maternal mortality, even child death, in women living in rural areas and among poorer communities? Are they not part of us? Are they underprivileged to be in such an area? Why don't we have the hands that care and the hands that can really help them to really live and make it in life? Young adolescents face a higher risk of complications and death as a result of pregnancy than other women. Why do we have this happening to our adolescents? We are talking of human resources of a nation. We want to increase in our population, or we want to kill and then bring an end to the nation when we are not making use of the midwives that we have? It is very important to have the skilled care that is needed during and even after childbirth. They save the lives of women and newborn babies. I mean the midwives. Key facts. The best partnership for a pregnant woman is with a qualified midwife. Next slide, thank you. Yes. If we are talking about midwifery, we are talking about women, we are talking about neonates as the heart of midwifery. What are the facts that we can get? What are those things that a midwife really needs so that we can do the work effectively? And what does a pregnant woman desire to really have a baby sound and safe? And of what importance are midwives even to these mothers and their neonates? Midwives are crucial to reducing maternal and neonatal mortality. We cannot replace the midwives by any other health worker. I repeat, the midwives can never be replaced by any other person within the health system. They are the ones that are endowed with the skills to manage pregnant women right from the antenatal care, through labor, into safe delivery, and even in puerperium. The midwives are the hands that care. We can never replace them. They are very crucial to reducing maternal and neonatal mortality because they know what to do when it comes to complications of birth. In the course of having their babies, we see many doctors calling on midwives around. Come, what is happening here? I don't understand. And the midwife will go there, do the work as if she's a magician, and the baby will be born without problems. Midwives in the art of midwifery are uniquely positioned to provide respectful, high-quality care that places women and newborns in the center. We are the ones that can really provide the care that is needed. Some people have mentioned it. We need to show respect and regard for our clients. There are ethics guiding our practice. We should not forget these ethics. If forgotten, we should bring them back into the system. We know that the art of midwifery is a passion, and we should not relent in our efforts to make sure that we do it the way it is expected, so that we'll all be happy for it at the end of our duties. This professional care is a significant contribution to the healthy families and thriving communities. Without a midwife, we cannot have midwifery. Without a midwife, there will be so much depletion in the human resources of a nation. This is very significant to a nation. That is the care a midwife gives. It makes a healthy family, and it improves thriving communities. Midwife saves lives and promotes the health and well-being of women and newborns across the entire reproductive, maternal, and newborn health continuum. If we are to go by midwifery, should have access to a midwife. Next slide, please. We are educated to international standards, and we can provide 87% of essential care needed for women and newborns. If indeed women and newborns are the heart of midwifery, midwives can do the work to make newborns and women get the quality care they need when in labor and afterwards. The best partnership a pregnant woman can have is with a qualified midwife. Without a qualified midwife, that pregnant woman cannot get the best of her condition. I was with Her Excellency Mrs. Toyin Saraki sometimes, and she just cracked a joke. And could you believe that these women, when they go to primary health centers, they are delayed there under unqualified hands, and by the time they had dealt with them, giving them a series of injections, treated them the way they wanted, and they could not get it, they now push them to the general hospitals. And when they get to the general hospitals with diverse complications, they may not get that, they wouldn't have gotten the needed attention as they went due. And when their conditions are complicated, it results into either the baby dying, the mother having complications like RVF, VVF, and the likes. And before you know it, they are blaming the nurses and the midwives in the general hospitals, which should not be. And this is to say that for the best partner for a pregnant woman, it is a qualified midwife. The proven benefits of having care provided by midwives are many. Yet, millions of women go through pregnancy and birth without a midwife or other professional care. This must change. We should be agents of this change that we are talking about. Let us ask. There is less interventions during labor, shorter hospital stays, breastfeed more often and longer, use contraception and space births more often. That is, if a woman should have an access to a midwife, the woman will definitely not have the preterm birth because it will be noted, and the moment it is noted at the antenatal care, there is prompt attention to prevent a premature delivery. During labor, you have less interventions. We have been taught and we know what to do at every point and at every stage of labor. It is only a non-midwife that will do what is not expected intermittently to a woman, and this might injure the woman. But a woman with a midwife as a partner closely by her side will have less interventions during labor. There are shorter hospital stays. We have been taught false labor, Braxton Hicks contractions. Instead of allowing them to stay within the hospital, they are sent home by midwives. But in a place where you have other health workers taking care of a pregnant woman, they prefer to keep them there to complicate their condition. Their babies are breastfed more often and longer because there is the education. Breast milk is the best. There is the explanation and the teaching on how you can hold your baby to breastfeed well, how often to breastfeed a baby, what to do in the course of breastfeeding. And we know that breastfed babies are more viable. Then there's use of contraception and space births more often. By the time before they leave the hospital, by the time they have delivered, before they leave for their homes, they are educated on spacing their birth. They know what is expected to be done. There are so many contraceptive methods that are really explained to them, and they have to choose to live a healthy life. So for us to have a healthy nation, for us to have women and newborns as the heart of midwifery, midwives must be well recognized and allowed to do the job. Extending midwives' care to all pregnant women would save millions of lives each year. If all women deliver with a midwife in a facility capable of providing basic emergency, it is estimated that 56% of maternal, fetal, and newborn deaths could be prevented. I was somewhere sometimes, and the country director was telling these TDAs, there had never been a decrease in maternal and child mortality unless you go back to the roots and use the skilled birth attendants who are the midwives. I was glad, but these are things we love to hear. These are things they say most often. But when it comes to implementation in our country, Nigeria, how does it go? How do they go about it? It is very, very important that a midwife should be made to be at the center of the woman and the neonate's life for survival and for the baby to thrive. We want to look at the global strategy and goal of ending preventable maternal mortality, addressing inequality in access to and quality of reproductive, maternal, and newborn health care services. We are talking about strategies to end maternal mortality and even to prevent it. There are inequalities everywhere. Why must I work in a rural area and not enjoy what a midwife in the city is enjoying? Why should I work under stress? Why should I work where there are no roads, no access to potable water, no light? Ensuring universal health coverage for comprehensive reproductive, maternal, and newborn care. Addressing all causes of maternal mortality, reproductive and maternal morbidities and related disabilities. Strengthening health systems to respond to the needs and priorities of women and girls, and ensuring accountability in order to improve quality of care and equity. Is our health system being strengthened? How does our hospitals look like? Our schools, how do they look like? Many thanks to NFPA that is really donating and donating and donating to make sure that our education is at par with international communities. We need more of partnership with other NGOs. If indeed women and neonates are the heart of midwifery, it means we have to invest in midwifery and even invest in the midwives. Most of the speakers that talked before me, they touched this area so well that I was glad. But implementation seems a problem. However, we believe we will get there. There is need to continuously increase investment in the education of midwives and growing the midwifery workforce. It is the only way to ensure that there are enough qualified midwives to care for all women and newborns. In my speech yesterday, I think I mentioned some advocacies. How are we bringing back those that have this knowledge into the system? Are we really having enough qualified midwives to care for these women and newborns? What is midwifery like? We need to improve. We want investments by our partners, more investments. Some people have been investing, but we want more in every area, in all areas, to make sure that we get what we want in midwifery and for the midwives. Investing in midwifery education could lead a 16-fold return on investment in terms of lives saved and costs of complications of pregnancy. Just like Dr. Bentley said the other time, as midwives, we have the passion of midwifery and we are doing the work the way we love to do it. We should doggedly, resiliently continue We can finish strong and make our impact felt if only we are assisted by our partners, the government, and even among ourselves. We can assist ourselves to really finish strong and work with love and compassion. Our advocacy were mentioned yesterday to make us recognize, to make us the hearts of women and neonates. We want so many things to be done by our government, and I'm happy to see that we have representations here. So I will go through the advocacy again quickly. We want automatic absorption of our graduates from schools of midwifery, both at both basic and post-basic level. We want to go back to the era of community midwifery. We want training schools to begin to turn out community midwives instead of having other health workers doing our work. Let us go back to the era of grade 3 midwifery. You know, they pass out, they give them that certificate of grade 3 midwifery, grade 2 midwifery, you are promoted like that. Renovation of present schools of midwifery and equipping with the state-of-art equipment. Thanks to UNFPA for doing that. Increasing the number of admitted schools for training in these institutions. Giving contract renewable appointments to retired but not hired midwives. Periodic updating of knowledge, capacity building of serving midwives both locally and internationally. Let our midwives be trained and retrained. It is not a sin. We can go outside the country if government really sponsors us. Collaboration with all development partners to improve the lives of women of childbearing age. You will allow me to conclude, because my time is up, to say every woman deserves access to the high quality skilled care provided by an educated and qualified midwife. All women and newborns should have the best possible chance of surviving and thriving throughout pregnancy and childbirth, because midwives care for women and newborns with skills and compassion. Thank you so much.
Thank you then, the President of the National Association of Nigerian Nurses and Midwives, articulating areas of improvement needing urgent attention. At this point, please let's put our hands together as I invite the representative of the Lagos State Governor's wife, herself, Permanent Secretary, and also a medical doctor. Please, can you come to the microphone? Dr. Shudaibi, please let's welcome our
is also a significant opportunity for every midwife to think about their professional growth with an aim to widen their knowledge and skills, especially as it pertains to the health of mothers and their newborn babies. Every part counts, because we never know, as any one of them will become a president, a governor, a midwife, Senate. But we have the hope that all of them, they will be great for this great nation. Midwifery is one of the oldest professions in existence. Before words like hospital and obstetrician ever existed, historical and religious books have documented the existence and relevance of midwives. They have played roles in saving lives at childbirth, with stories as that of Moses, who was saved by 2 midwives, Pua and Sheba. Midwives play a valuable role in our communities and in the primary healthcare sector. We help our women and their families understand the importance of prenatal care to improve birth outcomes. They educate and enable women to understand the normalcy of the birth process without fear. They provide support for enhancing communication skills, thereby helping women build self-esteem and better family relationships. They promote breastfeeding, indirectly reducing infant illness and increasing parental confidence. They offer a safe, low-cost, skill level of care to the women of our communities. And the most important of them all, they contribute to the sustainability of our healthcare sector in the area of maternal, neonatal, and child health, which is in line with the current Lagos State Development Plan. One of the 4 pillars of the Lagos State Plan is aimed at implementing sustainable social development for our indigenes. Because despite having the largest workforce in the nation, with over 1,000 doctors and 6,000 nurses, midwives in the state public health sector, we know that in comparison to our population of more than 20 million people, we have a lot to accomplish. This is why one of our major goals is to address the poor health-seeking behavior of the populace and drawing awareness to the role and importance of midwives in pregnancy and during childbirth. Knowing that we do not want any woman to die while giving birth, Lagos State is here to support the midwives who save lives. In all of this great strength of all our skilled midwives, their perseverance and dedication to humanity, here is wishing you a wonderful celebration and a rewardingly successful.
Mrs. Permanent Secretary of the Lagos State Primary Healthcare Board, representative of Mrs. Bolanle Ambode, Her Excellency, the wife of the Governor of Lagos State. Another round of applause for her. At this juncture, Your Excellencies, very distinguished ladies and gentlemen, we'll be taking a goodwill message from Her Excellency, the wife, the Governor of Abuja State, Her Excellency Hajia Hadiza M.A. Abuja, the founder and initiator of the Abuja Sustainable Women Economic Empowerment and Peace Initiative, with the aims of integrating women and forming a formidable force, uniting women, agricultural and empowering the women in Bauchi State and in Nigeria at large. I'd like us to please
of the President of the Federal Republic of Nigeria, Mrs. Aisha Muhammad Buhari, ably represented by Her Excellency, the wife of the Honorable Speaker, House of Representatives, Mrs. India Dugara, members of the High Table, distinguished participants. I am delighted to be called upon to give a short goodwill message in commemoration of the International Day of the Midwife. Today, we're examining the laudable role and impact that midwives have made on maternal and newborn health worldwide. Midwives, we know, are the first line caregivers to our women. They are the bridge between doctors and patients. They are also advocates to our women. I want to seize this opportunity to appreciate all the midwives for their commitment, for their selfless service, and for impacting on the lives of women, especially those in the rural areas. I also want to use this opportunity to lend my voice to the previous speakers who have talked about education and capacity building. I want to call on governments and development partners to invest more in capacity building so that midwives will be equipped with the necessary skills and attitude to enable them deliver quality health care to our women. Finally, I want to say I stand here to appreciate all the midwives here and the world. Thank you very much.
Thank you very much. I think she deserves another round of applause because for me, that's a sister. She used to be with NTA, then Central Bank of Nigeria, and now, back home to assist her husband. And you can see that education is so vital. An educated woman will be able to make her pact. So we need to train and retrain our midwives, but more than anything else, we should be advocates that every girl child gets education. Another round of applause for all of us here. We are gradually getting to the peak of this segment of today's event. We know that if you have been following the news, you know that the wife of the President, Her Excellency Mrs. Aisha Muhammad Buhari, has been going around the states encouraging and promoting women's health, free screening and the rest of it, and showing that we really, us men and women, must give special place to women's health in our country. And I think she deserves a round of applause for that. I'm very passionate about women's health. But I did say to myself that before I leave here today, and before Her Excellency speaks to us, we're all going to make a commitment individually and maybe collectively what you're going to do to ensure that we promote and improve women's health. And so before I invite Her Excellency to the table, to the microphone, I would want to, make a commitment to your neighbor, hold one hand and tell us, or tell her, we will find out what commitment you are making to improve the health of a woman and a child. Make a commitment. Well, I run a show on NTA, it's called Health Reports. My commitment is that I must always feature women's health as a priority. So I don't know what commitments you're making. Let's start from the president. Yes, what commitment have you made?
Yes, thank you. We are working towards committing ourselves to do the work more and bring back the ethics of the.
I'd like to round up on that, bringing back the ethics of the profession. So do we have the word of all the midwives here present that you will not shout at our women when they come in for labor, that you will treat them like human beings, and that you will have a friendly antenatal and delivery rooms. God bless you all. And it is on this firm promise and firm affirmation of a new paradigm shift to ensure professional excellence that I invite the representative of Her Excellency Mrs. Aisha Muhammadu Buhari, wife of the President, and invite to the microphone wife of the Honorable Speaker of the House of Representatives, Mrs. Gambia Bugara.
The members of the high table, permit me to stand on existing protocols. I count it a great privilege and an honor to represent the wife of the President in this wonderful and a great occasion. The first time that is happening in our country, Nigeria. Midwifery, as we can see, is an honorable profession. I wish I were a midwife. Not just a wish. I believe every woman is born, has the capacity and the ability to be a midwife. A midwife must believe in herself. I know a woman who believed in herself, left her country, came to Nigeria, went to Calabar, because she believed in herself, had a passion about stopping the killing of twins in her time. And because she believed in the cause in which she had a passion to stop the killing of the twins. She pushed for it. She went for it. There were forces that tried to stop her. But because she believed in the ability of herself, she eventually made a mark in Nigeria. Anytime you cross over to Calabar, there is a place that has been put for in her memory. Because a woman like you, like me, believed in herself. Nigeria is in a state where things are not happening. See, but if you believe in yourself, that you have something in the inside of you that you can give, wherever you're taken to, whether the remotest village, you have a seed in the inside of you that can bring that change to happen. You have the education, you have the machinery. What you learn, nobody can take it away from you. The situation, the economy, whatever, all you need to do is to believe in yourself. Have the passion. I see women of passion gathered here. Every woman is a woman of passion, especially the midwives. The wife of the president has sent me. 2, you know she's a woman that believes in maternal welfare and the children. So she has sent me to tell you that she will partner with the midwives to see to it that maternal death is brought to the merest minimum, to the barest minimum in this country, Nigeria. Without the help of the midwives, I think this goal can never be achieved, because they are in the center of it all, in the middle of it. They are in the middle of warfare between the life and death of the woman. Nigerian midwives, congratulations. They say a journey of 1,000 miles begins with a step, and the right step in the right direction. You're taking the right step today to begin something new in this nation. I believe there will be change. The Nigerian midwifery sector will be changed. Every woman will be touched by the rules you are willing to put forth. I celebrate you. I congratulate you. I'm happy. There is no better place to be than to be here. I'm happy I came. I'm happy she chose me to represent. Congratulations.
For the First Lady of the Federal Republic of Nigeria, wife of the President, are you going to give her a standing ovation? Especially with the way she's spoken so passionate about the midwives. Please, let's make it applause for her a lot louder, and then you may take your seats.
Thank you very much. Very reassuring, huh? Okay, and calling for more commitment. And ma'am, it's really not late. You're a midwife, you can be an associate. Yes, like and let's win more converts. Together we'll make a better Nigeria. Thank you all. We are gradually coming to the very first segment of activities that have been lined up for the International Day of the Midwife. A couple of announcements, please. Immediately we'll have the national anthem, and then we'll quickly have a group photograph with members of this side of the table, with the representative of Her Excellency the wife of the President, after which the UNFPA country representative will invite us to this side of the room. You can see some things covered up in some pinky outfit there. I know that I wouldn't want to say too much about it for now, but it's something about what all of us are aspiring for: better education for our midwives. Having said that, please, I would request that only the registrar of the Nursing and Midwifery Council will join the rest of us here during the presentation. The recipients would get their own moments in a few moments. You would announce the recipients of these equipment and things that are here. But please, principals, I beg you, remain in your seats. At the appropriate time, you can have a photo opportunity. For now, I'd like all of us to please stand up for the national anthem.
After the count of 2, 1, 2, sing. Arise, come, our
Thank you very much. The rest of us can be seated while we'll have the group photograph immediately here.
Sorry.
This same presentation was made last year to 11 schools of midwifery in 14 schools. Adamawa, Cross Rivers, Kano, Katsina, and Delaware states. The presentation was made by the UNFPA, and today we have 11 schools. 11 schools will enjoy this same gesture. The 11 schools are located in Kebbi, Imo, Yobe, Borno, Federal Capital Territory, and the states. Shall we please give a loud round of applause to UNFPA, helping to secure a better future for our mothers and our children. The London School of Tropical Medicine should please come up here and join the photograph. Thank you. Thank you very much. Shall we please applaud the London School of Hygiene and Tropical Medicine? They've been here since yesterday. Thank you very much. Please, will all remain seated in the hall while the country rep of UNFPA will lead the dignitaries for the presentation. Please, will remain seated. This will be over in another 5 minutes. Thank you.
go anywhere. I want to do something now. Watch something. I don't be where they work. Now they look out.
Yes, please.
Thank you very much. The registrar, can we have the registrar here?
Her Excellency, the wife of the President and Commander-in-Chief of